Good day, global citizens. Welcome to another episode of Dr. Fajembola'S Opinion. It's an honor to have you on this episode and to read your encouraging comments across different social media platforms. Today, I have someone. I won't say. Normally, I usually say a very good colleague. Yes, but today I have someone who I am grateful that he honored my invite. Someone who knows what he's doing with regards to medicine. Is a colleague of mine. I also put him a good colleague because he's also a medical doctor. Dr. Okeke. I actually thought your name is Okereke. I was discussing with Dr. Okereke, another Dr. Okereke a few days ago. So my mind was like, Dr. Okereke, I'm just realizing your name is Dr. Okeke Collins. Dr. Okeke Collins, how are you doing today?
I'm fine. Are you?
I'm good. Dr. Okeke Collins, you're from which state in Nigeria?
Enugu State.
Enugu State. Enugu State is known for Opaya, right? They have the best Opaya in Nigeria. And which soup is Enugu State known for?
I think
because to me, I believe, I know there is usually there are usually soup wars on social media in Nigeria, but to me, I believe Igbos make the best soups because my mom makes Igbo soups, white soup or hard soup. So which soup is Enugu known for? I know Enugu is known for Opa, but which soup is Enugu known for?
I think it's egusi.
Egusi, sincerely? Wow.
I think.
Wow. I thought egusi.
But I think Igbos they cook almost the same thing in terms of soup. And maybe one or two things that differentiate one Eastern state to another.
Okay, that's beautiful to know. Actually, that's new knowledge to me. Thank you so much. Let me give our audience your brief biography. Dr. Okeke Collins Chinedu is a medical doctor from Nigeria, currently completing his 1-year National Youth Service Corps. He earned his medical degree from the College of Health Sciences, University of Port Harcourt, where he developed a strong interest in research and academic writing. How was your stay in Port Harcourt?
It was nice.
Rivers, Port Harcourt. Okay. Dr. Collins has published 8 peer-reviewed articles and served as a reviewer for 8 manuscripts with the Cureus Journal of Medical Science. He previously held leadership roles as House Officer Representative, Financial Secretary, Electoral Secretary, and Team Lead of the SiGAF Anaesthesiology Group. Beyond medicine, he is a passionate athlete and has won national medals in badminton, tennis, and basketball at the National Medical Association Games. He is also an avid fan of Formula One, tennis, badminton, football, and basketball. A committed Christian, Dr. Collins is deeply inspired by faith, service, and global medical advancement. Very beautiful biography, I must say. I actually have a high respect of people who hold their faith like very closely, who are like active faith-wise. And also, this is beautiful to note that you are multi-talented in different aspects of sports. And I wonder why, if I'm multi-talented in sports, I feel medicine will be a side hustle, not the main hustle. You understand? Because you are interested in many things. And one beautiful thing I appreciate about your biography is also the leadership roles you were able to combine with medicine. One aspect that also I did in my previous years is combining different roles with medicine. And I don't know, for some people, how do you feel combining? For those watching us, I just want them to know your perspective about combining leadership with medicine.
Okay, leadership is what comes to me natural. So most times, or these days, I run away from it because even if I feel running away from it, it comes back to, I feel that it's haunting me.
It's haunting you. Did you like hold any position at undergraduate level?
Yes, a lot. A
Okay,
lot.
okay. I
You asked
was
me to make
also
it brief, so I have to I
understand.
have
I
to make
fully
it brief.
understand.
Yes, I have
I
to
held
make it
also
brief.
positions at undergraduate level, and what you said is right. Some people, some of us, even if we leave leadership, like if we, no matter how far we deviate from leadership, like it keeps coming for us. You
Keep
understand?
coming back.
So there are some people like that, and thank God it gives us the energy and the capability, the capacity to be able to deliver in whatever positions we're given. So, Dr. Collins, today we
Even
are looking
so,
at you.
please let me digress a bit. Even to the
Okay,
extent that here I'm doing my national youth service, it's in the village. So I came here, there's no water supply because the summer got bad. It got
okay,
bad around July of last year. I started
okay,
youth service November. So when I came, I tried my best and everything. So since that it was difficult, I started meeting people, prominent people in the community, telling them
okay.
that how it is for a hospital like this. There's no water. What of your core member? What of your staff? What of the community people that come for admission? They can't be using the stored water in the tank. So, we are likely to spread infection. Somebody cannot come to the hospital and still not get better, or a relative cannot come to the hospital and fell sick. So, this was my
Exactly.
appeal. It was last week that somebody that promised us came to call the sumo people, they installed a new sumo, and we have water. So, it's something that I can't run away from. I feel that maybe when there's a need, in a way, God pushes me there to try and fulfill that need. And when I'm gone, they'll enjoy it. Maybe another place will still spring up again. That's why these days I feel that it's something that is inevitable.
Thank you.
I
Thank you for
can't run
sharing
away
that.
from it.
Thank you for sharing that with us. Actually, what I feel is when God sees you as someone who is responsible, because God does not give leadership for people like that who any space they get to, like the old leadership positions, you have to be a responsible person. That's why God gives you the mantle because He knows you can deliver. There are some people that might have been there before you or might even come after you and they don't really care what is happening in that
Yeah,
space.
yeah,
But because they're a
yeah.
responsible person, God gives you the mantle to deliver to whatever He wants to do for the people. So that's one aspect. Also, I also pick from people who are always leaders in any space they get to. So, Dr. Collins, as I said when I sent you the invite, like this platform is to relay scientific publications in way the layman can understand, in way that if a man, a woman selling ugu in the market, if she watches this video, she understands what you are trying to say from your publication. A way that if a man who understands English but has never been in the four walls of a medical school or any science space or even a class can watch this video and understand. So it's not only, I mean, for we medical professionals or learned people, but also the layman to be able to understand. And since this platform is also for the layman to understand, I try to, well, today we are looking at TB. I try to get some quotes on TB, some what are people saying about TB on Twitter, because you have to get people's perspective. And before we go dive into the discussion, the first tweet I got about TB is from Dr. Zainab Dambazau, where she said bovine tuberculosis, which is a type of TB, can be transmitted to humans through the consumption of contaminated meat or dairy products from infected animals. Parts of the animal that are affected should be discarded and not used for human consumption. It is important to follow food safety guidelines. Not just TB, one aspect which is hard, even when there is bird flu, is for people to throw away meat that is already infected, and not even now with the current economic state of the country, if there is any outbreak or if there is any disease affecting any animal, like it will be hard to talk to the people except maybe health stakeholders, relevant stakeholders coming to make sure such meat is not consumed by citizens, it's not in the market. And that tweet I got actually a few days ago, since we are talking about pulmonary TB. So my tongue is twisting. Pulmonary TB is Inyakudi reports where a celebrity actually 2 days ago, I guess this is like a Congolese flag. He died few like 2 days ago, even yesterday. Seems it's yesterday or 2 days ago he died. Renowned reggae hype master John Maynard, popularly known by his stage name MC Fullstop, pronounced dead after a prolonged battle with lung tuberculosis, sparking an outpouring of grief and tribute from fans and fellow entertainers. May so rest in perfect peace. But this is an example because he's a celebrity. That's why
Yeah.
there's
Yeah.
like
It's
I
out there.
taking the light, like exposing pulmonary TB, but normally people are dying every day
People are
from
dying. Yeah.
TB. So the last tweet is from Apopo. You see, this is about lab tests. The best way to stop tuberculosis is early detection and treatment. One Euro rat can screen 100 samples of TB in under 20 minutes, a process that can take lab techs up to 4 days. Once confirmed, patients can get on life-saving treatment. So this is about lab rats. I'm talking about Euro rats and how they can be used to fasting lab processes and get to the treatment of more TB patients. So those are the 3 tweets I wanted us to look at. One about the lab, best way to stop TB. One about a celebrity dying from TB, and also looking at another type of TB and how TB can affect us in our society. So now let's dive into the discussion. When I was in medical school, I won't lie, I have actually one of my lecturers I respect most is someone that works on TB. Hopefully he can join me someday in the future on this platform, Dr. Baluku Joseph. But one thing about the TB word, I don't know if it was like that in your medical school. TB word has a particular stench, like particular smell. I don't know. Was it like that in your medical school? Like my own TB word, I don't know if I was the one or other people felt that way. Like TB word had a particular smell, minus the constant need of wearing a mask and going into interacting with patients. Even sometimes when I wear the mask, I also feel it. So when I got this paper, one thing I appreciated is your discussion of a droplet and aerosol. And some people might not understand the difference between a droplet and aerosol, and these are important in infection transmission from one person to another. And then not just TB. In previous episodes of Dr. Fajembola'S opinion, we talked also about COVID-19. So people should know the difference between a droplet and an aerosol. One thing with a droplet is bigger than an aerosol. An aerosol is smaller, which is also called a nuclei. I see you refer to it as nuclei, in the paper. And also, one thing is, I want people to, I don't want to use too much terminologies because this is for the layman. Droplet is bigger, nuclei or aerosol is smaller. Then I want to bring up the fact of format. If I have my phone and I mistakenly sneeze on it, my phone, the surface of my phone is a format. If I sneeze on a door, the surface of the door is a format. Any material where an aerosol or a droplet is on is a format. And basically that's the difference I want to give. I don't want to go into gravity, distance. Yeah, we know that aerosol moves longer distance, you understand, which is the nuclei, it moves longer distance, the droplet moves shorter distance. The specific gravity, I don't want to go into that, but I just want the audience to know that when we talk about aerosol, which is also nuclei, it's smaller, while the droplet is bigger. Let's say droplet, let's say rain. example, when a drop of rain falls on you, that is a droplet. It depends on the respiratory energy, how you bring what are they calling it? The fluids out of your airway. So basically, I wanted to shed more light on that. And talking about pulmonary TB, which we encourage, I actually encourage people to go into the paper when after watching this video to understand it. But one thing is, when we talk about TB, what people don't think about is the lungs. You understand? Pulmonary TB alone, why
That's what,
there is
yeah,
extra pulmonary TB can affect your
yeah,
brain membrane,
yeah,
can affect your skin,
yes,
can affect your
yeah.
bones. You understand? So when I want you who is watching or is listening to this, because this will also be in the form of a podcast, who is listening to this to know that TB is beyond the lungs. TB is beyond the lung. It's not really just about the airway. It can also affect um, other organs of your body and also other systems. So let me not go too much into it. Let me ask some questions and we continue with our discussion. What are they calling it? The first question I have for you is, you said in the paper data was driven from inception. From inception, what were you trying to refer as a period of inception from the paper?
Okay, what I was referring to was the beginning of the database. Okay, if I go on to PubMed, I won't give a restriction. I won't tell the PubMed that give me papers that talked about pulmonary tuberculosis from 2000 to year 2005. So I just key it in. I'll just um, um, allow the database to synthesize article for me from the time that pulmonary TB was published in their journal to in their database to the recent time. So like that, I want to look for papers as much as possible I can, even if it's 1990. I need it. I want to look at it. Even if it's 1980s, I want to look at it. So that's what I meant by inception. So I want to look at any paper that talks about TB in across all the databases.
Okay, so when someone is reading the paper, I say reading, is reading the paper, they know that what you are referring to is from the beginning of what
From the
PubMed
beginning.
has, your search engine, what
Yeah,
is as data for pulmonary TB. That was what was
yeah,
used. From inception is not
yeah.
from when Adam was created. So don't think
No, no, no.
so because like I said from inception, is it from the
Yeah.
beginning? Is it from when Adam was created? Is it at the beginning of at the end of Second World War? When was it? So they now understand it's
Yeah.
from when it's according to what the PubMed has, which is the search engine has on pulmonary TB. So Dr. Collins, I would like to know, when we talk about TB, HIV comes up often as a comorbidity. HIV is usually mentioned in discussions, despite mental health being the most reported morbidity. Actually, it's from the paper I understood. To me, if you ask me before I read your paper, I have to be vulnerable and I have to
Yeah.
be frank because normally I'm someone who is
Yeah.
frank and I say it the way it is. Before I say it the way it is. When we talk about TB, Dr. Collins, HIV usually mentioned in discussion despite mental health being the most reported morbidity. Do you feel mental health is downplayed as a comorbidity of pulmonary TB in Africa? Why? Because prior to reading your paper, I have to be frank, I didn't know that mental health actually is the most common comorbidity. I was thinking HIV because wherever you talk about TB, HIV is coming in. So from a paper I
Yes, I
understood
understand.
mental illness as not mental illness, mental health, even though as much as it's stigmatized, like it's the most common comorbidity. Do you think it's downplayed, and why do you think it's downplayed, Dr. Collins?
I think it's downplayed to a great extent because, like you said, when you talk about pulmonary TB, what comes to mind is HIV. However, most of the times we look at the cause, what can cause or what can exacerbate this pulmonary TB in a lot of people, and we always hold HIV accountable because it used to mess up with our immune system, thereby reactivating a latent pulmonary TB latent tuberculosis. Then now they don't look at okay, you have started this patient on medication. What happens next during the course of the medication or after the course of the medication? What happened to this patient? Let's look at this person. What happened to him after he has finished taking his or her medication?
Okay.
So that was how you tend to see all the other aspects because some people we also think that yes, we'll talk about lung infarction or lung involvement should be the cause of the morbidity because yes, TB affects the lung. But what of the health of that mental health of that person that is being taking that medication for a very long time? What if in the first month he or she feels that it's not getting better? It messes up with his mental health or feels that the other people are not taking medication or me taking this medication might feel that people might say that I'm suffering from a terminal illness, I'm losing weight. What must have caused the people will think that I'm having one other terminal illness that made me to lose weight. All these other things usually play around in their head. And Africa is a place that we usually don't talk about mental health because there's a very big stigma that is usually associated with mental health in Africa. And this tends to, even if I'm having all these things going through my mind, I won't be open enough to tell people that or tell my healthcare provider that see this is what is bothering me, this is what I'm noticing so that I won't be referred to a mental health clinic. So now, just the person now say, imagine I came with TB, I'm now taking medication for TB. Now they are now referring me to a mental health clinic. Means that my condition is a bit compounding. So it makes them to have that fear, the stigma, and to relax. And of course, it might also be as a result of the healthcare professionals, the first responder, not being able to look at it and were able to pick up those signs and symptoms of mental illness in their patient, not necessarily about giving them the medication. We should also do reassessment of the patient to know if the patient is okay, both mentally and clinically. Yeah.
Thank you so much for shedding more light on that. Seriously, not even TB. It's let me put it is the most infectious. What are they call it? Disease again now in the world. But normally, even malaria, having malaria, which is even considered as common, we feel its effect on mental health. Like, why me? Why am I down? Why do I have to use this drug? Why do I have to take this injection? Let
Mm.
alone pulmonary
Mm.
TB. And like you said, with what comes along with it, the losing of weight. Why won't people ask me why am I losing weight? Um, Continuous use of the drugs, trying to adhere to the drugs can drastically affect the mental health of someone. So thank you so much for shedding more light on mental health in among TB patients. And I'm optimistic with platforms like this. It won't be downplayed as a comorbidity of mental health won't be downplayed as a comorbidity of pulmonary tuberculosis. And that question for you, Dr. Collins, is when prior to this episode, the first episode, we talked about COVID-19. Second episode, we talked about HIV. And coincidentally, Africa keeps coming up in the discussion. From your research, Africa came second at 23%, with for pulmonary TB, which is 1/4 of global total as compared to HIV, where we have 2/3. Actually, Africa is 2/3 of global population for HIV patients. Low and middle income nations account for, from your paper, low and middle income nations account for 8% of occurrences of TB. Yes, we've talked about HIV, we've talked about TB on this platform. As a lead author, why do you feel low and middle income countries account for 80% of pulmonary TB cases?
I feel that why they call us, when they mentioned low and middle income countries, depending is they're being categorized based on the poverty. They might be categorized based on the poverty index, because if they are not poor, both infrastructure wise, both income wise, they will be categorized as high income countries. However, a common man in a poor or middle income country, what he cares about, what he thinks about is what to eat, how to feed his family, how to make money.
Yes.
Some of them now, in the pursuit of all those things, some of them might not even have money. You have to have money to, if you have to feed, take care of your family before you think of accessing the healthcare. And of course, most of them, healthcare can be expensive because they don't have, they're usually, most of the middle and low income countries usually out of pocket payments. Now,
Yes.
an ordinary man wants to take care of his family, what to eat. So now those things are taking majority of his budget. Now going to the hospital, he would prefer to go to somewhere else that might be cheaper, and he will receive a poor asset that might not know what is wrong with him, thereby thinking that is something that will go away, or something that ordinary medication will resolve. Now, um, this thing puts other people in danger that comes close to him. All of them are sleeping in the same place. We don't know the type of housing they have. Point structure, infrastructure housing. Is they might be in an overcrowded area. Now, help to disseminate this organism to other people. Now, an ordinary man will want to go out and work. Any work he wants will be okay for him to fit. Maybe going to a construction company or infrastructure company where they all these offshore sites where they stay all together, packed up everybody in one place. So from there, if somebody that has kind of leading to overcrowding, somebody that has TB, they can also disseminate it. So, and of most of the low and middle income countries, they have a high birth rate. Population is high. So, with increased population, increased dissemination, with more testing, lead to higher number and high burden of pulmonary tuberculosis among them.
Thank you so much, Dr. Collins, for shedding more light on that. Actually, poverty, it's the skeleton here. That's the main guilty man in this discussion. Why we have low and middle income countries having such high index when it comes to HIV, when it comes to pulmonary TB, when it comes to antimicrobial resistance. But I'm optimistic with the new public health order. Africa CDC is working highly on the new public health order. I'm optimistic the statistics will reduce in the coming years. That's why we have the 2050 TB goals, and also we have more discussions and more funding coming up for pulmonary TB. I'm optimistic. I'm also optimistic that with more advocacy, we'll have better water and sanitation hygiene to reduce even our exposure to fomites and infecting ourselves at different levels in the society. Thank you so much for that, Dr. Collins. In the paper, 11 countries were assessed with male statistics more than females. I will categorize this mainly, sincerely, jokingly, as another reason why men die earlier than women. Because men are more in these statistics, with focus Okay, Dr. Collins, now, with focus on the giant of Africa, Nigeria still holds the position of the country with the highest TB burden in West Africa, with an absolute estimated incidence of 407,000 in 2016. Do you feel this is due to our population? Because we are the giant of Africa,
Mm,
we are blessed, yes, but do you feel we have this high incidence because of our population as a nation?
I would say yes and no. Yes, because of the population. Then no, because like you said, there's a lot of tests that have been done in Africa and reports that have come from Nigeria. A lot of hospitals do tests and a lot of reporting and a lot of statistics. So other countries might have, but because of poor reporting, they might not actually report it, they might underreport it. But there's good reporting in Nigeria and we have the population. So yes, I feel that is our data are always there. Even if you want to search up some things in Africa, you keep seeing Nigerian articles being published. And so we do all those things. We also show our statistics out there that look at what we are doing. So they're able to, populate those statistics and put it out there that yes, we are this is the incidence in Nigeria.
Okay, thank you so much for shedding more light on that, on why we have high incidence of TB on the continent. I totally agree. Nigeria, we are doing lots of research is coming out of Nigeria as compared to, I'm not saying globally, global scale, but lots of research is coming out of Nigeria which in relation to other African countries. So that's why you find out that we have more information, more data compared to some African countries. And also Nigeria, how many are we now in Nigeria? I guess you see some reports say we are 200 million, some reports say we are close to 300 million. I don't know the last time census was done, but this is from
Right.
whoever is supposed to do census, whether National Bureau of Statistics or National Census Commission. I don't know if there is something like National Census Commission. Please,
Yeah.
you people, Nigerians, the relevant stakeholders, should we should have our next census soon so we know how many we are. If we are 500 million, let's know our population as the, let us not keep claiming the giant of Africa when we don't know
Yeah.
our population size. Thank you so much for that, Dr. Collins. If you were to because I want this to be a platform that is understood by the layman. If you had to describe the pathophysiology, I know I sent you this question and I didn't ask you if you were good at pidgin. I just assume every Nigerian is good at
Yeah,
pidgin.
every Nigeria, yes.
Is good at pidgin. So if you are, what I'm saying is I want this to be something people even outside STEM can understand. If you are to describe the pathophysiology of pulmonary TB to a MTB to a bus driver who understands only pidgin, how will you describe it?
Okay, I'll be
I dey
like
try know my
uncle,
pidgin no dey,
auntie.
even though when my pidgin no dey smooth, but I dey try sha.
Yeah, I get that. I'll be like uncle, auntie. I want hear you something. I know say you go don hear am before, but I wan really tell you the koko how e dey take dey affect person. Now, this thing wey I wan tell you now na something wey dey call tuberculosis. I know say you don dey hear am well well as TB. As you dey hear am as TB, you go say wetin anytime wey person cough, e go be like it sure say no be TB dey worry you. So so I wan tell you now wetin be TB, how e dey take dey how person dey take dey catch am. So if you person catch am, how e dey take dey move to your body wey go make all dis thing go start to dey happen for person body. Now if person dey close to you wey dey cough and the person carry get the infection, because person fit dey cough, e fit be ordinary cough, but if to say person get that TB infection for im body, as im dey cough come dey close to you, now if im dey cough, if im no dey cover im, if im no get anything wey dey cover im mouth or im nose, as im dey cough, you wey dey close to am, you come dey breathe in dey breathe out go some. As you dey breathe in dey breathe out, you dey breathe in that TB wey we dey talk about. As you dey breathe am in, im go from your nose go the pipe where they take the breathe. From that pipe where they take the breathe, you go come go your chest, where your lung dey, you go come dey there sit down. As him don sit down now, your body go wan come fight am because na foreigner wey him be, your body no need am. Him go come send the soldiers make him go fight am. If your immune system, the soldiers strong well well gidigba, the immune system fit kill all of them, clear am for your body. Or if your soldier strong okwa, him go form wall around am make dey guide am, make no comot go cause infection for your body. But if your immune system no strong, if your immune system no strong, like all those people wey get HIV, wey do transplant, if your immune system no come strong, as that TB dey enter your lung, e go from there multiply, e go stay small, come multiply, build, born children, born pikin, born grandpapa, born grandmama, oya dey send dem pikin make dey go school, make dey go market. Na so dey go just dey scatter scatter for your whole body. From there now, im go come dey, and dey go dey chop now, im go start to dey chop your lung, dey chop am. Na im make the person go dey cough, na im go make the person go dey cough. Im breathing go dey somehow. Before you know it, the person go come dey lose weight because im don send dem go market, send dem all over the body make dem dey chop the person. Before you go know am, the person go dey be feeling lie down for night, heat go dey do am, heat go dey do am. So na why those people be say, na why they dey always dey cough well well, and na why they dey always dey lose weight, and na why they dey always dey sweat for night. Then those ones wey be our immune soldiers, wey be our immune system take guide, dey there. If to say that person immune system maybe later the person immune system come fall, the soldiers don dey die small small wey dey guide am, and the person immune system come fall, na im make that thing wey dey guide, nobody go guide am again. Im go start to dey multiply because nobody dey guide am again, no security man dey there again. They go start to dey multiply again, start to dey cause all those infection. Now like this wey pulmonary tuberculosis dey take dey affect people. Na wetin I say I wan tell you be this, and I hope say as I tell you like this now, you go fit tell am mama wey dey for house, or aunty wey dey for road, or your brother wey dey for somewhere else. Na so you go take tell am say na how TB dey take dey affect person.
Deserve an standing ovation for that explanation. Sincerely deserve a standing ovation for that explanation. Excellent, excellent, excellent. Mama, papa, auntie, uncle, if una dey watch this video, if una dey listen to this, to listen to us, if you start to dey lose weight, if you start to dey cough, if you start to dey sweat for night, go hospital, go test whether you get TB. No wait to dey ask, no go dey use drug from pharmacy, no go dey use agbo, no go dey use local medicine, no go dey ask people questions. Just go hospital, go meet doctor, tell am the symptoms, and they go test if you get TB or you no get TB. And if you get TB, they will start treatment. TB no be do or die. If you start treatment, you go get better. And TB fit get cure. They fit cure you completely. So the earlier you start your treatment, if the earlier when you start your treatment, when you get TB, the better. So thanks so much, Dr. Collins, for that. I actually enjoyed it more than I should. Or should we continue the rest of our discussion in PG? Okay, Dr. Collins. And that question for you is, what is the difference between sputum and saliva? Because the paper is red wide, even those for those even outside STEM. And if someone come around the word sputum, you see that, okay, Google it, but not everyone can be like, okay, let me Google it. They can just assume, okay, maybe it means something else. What's the difference between sputum and saliva?
Okay, I think a lot of people, especially in Africa or Nigeria, a lot of us don't know the difference between a sputum and a saliva. They always say that anything that comes out from your mouth is sputum or saliva.
Yeah.
So it depends on the one that comes out from their mouth. Either they call it a sputum, you take. They call it a saliva, you take. So, but actually, sputum is thick. Our mouth produces saliva all the time, but sputum is thick. except you bring it down to the person's local dialect, because I feel that each region in Nigeria has what they call sputum. So I feel that each region in Nigeria has what they call sputum. Except you ask them, like when you are collecting a patient, you ask, do you bring out something like this? The person will be like, yes or no. Except, but apart from that, they call it either they call it sputum or they call it saliva. So it's less for us healthcare workers to take what we want to. But sputum is thick and is being expectorated from the lungs or the distal part of the respiratory tree. But saliva is being secreted by the salivary gland in our mouth to help us to, masticate and digest, masticate and send food down to our GI. So sputum is not something that we produce often. But saliva is something that we can easily produce because it's being secreted by the salivary glands in the mouth. So that's the difference between sputum and saliva. Then also saliva is watery while sputum is thick and can assume different colors based on what is happening in the lung because it's a representative of what is happening in the lung because it also contains more of the bacteria that is in the lung. That's why we do sputum culture for this microbacterial tuberculosis.
Okay, thank you so much, Dr. Collins, for explaining that. Anyone who reads the paper understands the difference between sputum and saliva and what you're trying to explain with regards to pulmonary TB. Dr. Collins, TB injection is given to babies. Please explain to global citizens why they have a positive tuberculin skin test even when they don't have TB infection.
Okay, I have to say that vaccination is one thing that is taken seriously in low income country, Nigeria especially because after giving birth, they be like, "Ah, go and vaccinate your child, go and vaccinate your child." It's something that majority, a good number of people that give birth, even in the rural environments. In my facility here, the government provided a cold chain, a solar powered refrigerator for storing of vaccines. So it's good. So now, but when a person is being given vaccine, BCG, so what it does when it enters the body tries to form an immunity to it and form a memory for that vaccine in the sense that when somebody comes in contact with that organism again, like when you give the a tuberculosis skin test, when you inject tuberculosis skin test through the circuit, since the body have formed a memory of that organism, the body tends to mount a delayed type of hypersensitivity reaction to it, so that it now cause that a raised induration that used to appear to it. So it's the body, it shows most of the time it shows post pre-vaccination against that organism. That's why the body was able to mount immunity against the tuberculosis skin test.
Thank you so much for explaining that, Dr. Collins. Is TB not the first
It's the
vaccine
first.
given here? It's the first vaccine given,
This age,
and I really commend low and middle income countries and Nigeria to be specific for the drive on TB vaccination, even at the local level. Um, we have male predominance, as I mentioned earlier, um, for TB in this paper, male versus female, male be more, which aligns with global trends suggesting higher incidence in males due to biological and behavioral factors. According to this paper, what were you and other authors trying to relay as biological and behavioral factors?
in terms of the biological factors, there is an article that says that in women, because of estrogens, that estrogen has a protective factor for women and men. We don't have the estrogen, so because of that protective factor, it tends to protect them. It tends to cover a lot of things. Strengthen the immune system, compared to the men. So that's the biological factor that some authors were able to identify. Then, in terms of a behavioral factor, like you said, like man, we venture in a lot of things. Somebody that has a latent TB might not know that he has a latent TB. Goes ahead to explore. I call it explore. Maybe engage in heavy alcohol that is smoking that will tend to decrease his immune system or engage in okay, some of them that are consultant workers might go for their outside job and stay with other people that interact with other people that have TB, or staying in an overcrowded environment. So basically, the men tends to engage more, explore more in things that might be harmful to their body and reduce their immune system. And
Okay,
like
thanks
you
so much,
said
Dr.
earlier, that's
Collins.
why female live longer than male.
Thanks so much, Dr. Collins. Actually, many people are known to be explorers. You explore nature, you explore different drinks, you explore different behaviors. So that's why you have more incidents with regards to not only TB, even other diseases. And with more, even going to the hospital, you find that male have lesser health seeking behaviors. So
Yeah.
I'm optimistic with more awareness, with more advocacy from doctors like you, with more education, even at local, state, and national level, we'll have better health seeking behaviors of male, we'll have lesser men taking shisha, vaping, alcohol, and the rest, and other behaviors that might predispose them to pulmonary TB. And if you are watching this, please have good health behavior and please go to the hospital if you have any symptoms of TB. Dr. Collins, I usually do this for every guest researcher. I'll ask you to rename the paper, the topic of the paper. If you are to give the paper another title, what will you give it?
Hmm. If I'm to give it one, because when I started it, I wanted to look at the morbidity of pulmonary tuberculosis. I was open minded. I'm usually open minded when I want to start any research publication, but after the after my results, I was thinking of renaming it, but I said no. I was open minded already because if I try to rename it, I might be biased. You know,
Okay,
I might be. Yes, so I have to. What I wanted to rename it is morbidity of pulmonary tuberculosis beyond the lungs. That was what I wanted to rename it, which of morbidity of pulmonary tuberculosis beyond the lungs. That's what I wanted
thank
to
you.
rename it, but I said let me leave it like this.
Thank you so much. I'm sure from this, the audience understand that pulmonary TB actually goes beyond the lungs. So the next time anyone mentions of TB, they know that okay, it's beyond the lungs. It's not only a disease that affects the lungs. Dr. Collins, please can you give relevant stakeholders 3 recommendations on TB management? Because there are different people watching this. What recommendation? Top 3 recommendations. I know you have many. Just give us three. Just give us 3 recommendations.
Okay, number one is awareness. Awareness has to be as high as possible because if I'm aware of what I'm suffering, I will be able to, this health is not all about coming to the hospital and you know what you are suffering. That person that
Yeah.
came to the hospital and tell her everything about his ailments, when he goes outside and sees somebody that is say, I've had this thing before. This is what I did. Go to the hospital. Or you go to the church, give some health talk to them. When they go home, they will spread it out. So health awareness, health awareness, health awareness, radio, TV, church, market gathering, social media. People should know about pulmonary tuberculosis. People should know about the pathophysiology. People should know that it's a curable disease. People should know that people should know. I think the investigation is free. Yes, the investigation is free. The test is free. It's not, you won't pay your money. Even the treatment is free. Even the X-ray, to the extent that the X-ray is free. Yes, the X-ray is free.
That's
So people
beautiful
should
to
know
know.
about all this. Yes, it's free. In my facility, it's free. They will give you a referral
Is
letter.
the facility
Go
a
there.
primary health care or a general hospital?
It's a general hospital. It's a
Okay,
general hospital.
okay,
It's free.
okay.
They give you a referral
I
letter.
hope it's also across all other hospitals in Nigeria. But since
Yeah,
it's free in your facility, there's a high probability that even though if they have to pay in other facilities, other government hospitals in Nigeria, it will be a token.
yeah, yes. So they should know about it. So if you know that yes, it's a curable disease, and I may not spend, even if I'm going to spend just a token, and yes, it should encourage people to come to the hospital when people are coughing. Like the other day, I was seeing a patient, and the patient was relative that came with the patient was coughing. The lab scientist came with a bottle, a container to give to them, so that they will pause Putin and take it up. That's how we, screen to try and identify the incidence of it. So that's that. So health awareness, health awareness, health awareness. Then secondly, from my study, I noticed the mental illness aspect of it, which I don't think is being incorporated into the TB management, which I feel that it should be incorporated. Also, training of the first responder to pick up some of the mental illness that patient might come into and do an appropriate referral to a psychiatric clinic. Then provision of quick diagnostic tests for pulmonary tuberculosis, so that once you come, they test you. If it's positive, they commence treatment immediately. So these are the three areas that I feel that this area that I feel that should work on, and I feel that it will help a lot of people in the long run.
Thanks so much for Dr. Collins for those recommendations. I hope relevant stakeholders, whoever is listening, will pick what they should pick and utilize it effectively for the better good of Nigerians. I want to close this session with an experience I had because I attended the UN high level meeting in 2023 on TB, and where it was reiterated that approximately 22 billion US dollars is required each year for TB prevention, diagnosis, treatment, and care in order to fulfill the worldwide objective by 2027. I also want to reiterate that integration of mental health, which we discussed earlier, services into TB care by incorporating routine mental health screening and support services into TB treatment programs. It is effective for general outcome, holistic management of these patients, and also the general outcome of what they will have, their prognosis. I don't want to use medical terms. Outcome, let me use outcome for the outcome that patients will have, the results actually you have as a patient. Integrating mental health. For those, I know everybody know mental. When they say mental health, we're not trying to stigmatize you to say that you are mad or anything is wrong with your brain. It's just a part of health that has to do with your psychological. I don't use psychological again. Your your brain status in regards to health. We know that health is in different aspects. Public health is the health of the public, of people. Mental health is the health status of your brain. We're not trying to say that you are sick or anything is wrong with you. We're just trying to say you should be alert. You should be sharp when we are managing you. When Dr. Okeke Collins is managing you for TB, or any other doctor in any part of the world is managing you for TB. So we're not trying to say that anything is wrong with you. Doctors want the best for you. Doctors seek out the best for you, and that's why I feel doctors should be the most paid people on the globe, not footballers that are receiving millions of pounds. And I'm using this platform to advocate for doctors. Doctors should be the most paid occupation on the globe. They shouldn't be talking about what they are being paid, be it the global north, be it the global south. be it US, be it United Kingdom, be it Australia, be it Nigeria, be it Ghana, be it Togo. Doctors are talking everywhere. We should be the most paid on the globe, because if another pandemic happens today, it's the doctors you are going to run to. We are the ones that will be at
Yeah,
the front line, not the footballers.
yeah,
Footballers will probably be in their houses resting that they can't play the ball,
yeah.
but we'll be there for you. So please, relevant stakeholders, anybody watching this, please, we should be the most paid on the globe. And that's why we have more doctors leaving medicine, because we are paying them peanuts, and the what we are exposing them to is and also the workload is heavier than the pay that you are giving them. We know it's a call, medicine is a call, but when the call wants to take your life, you first look after yourself. So please, this is a platform to advocate for that. So in Dr. Collins' paper, one thing I also appreciated was the NTB strategy 2025 goals. What are they looking at in regards to TB, which in for 2025 goals is the World Health Organization aims to significantly reduce the global tuberculosis burden by 2025 and 2035. But in 2025, so in 10 years' time also, these are the things they want to achieve. A key milestone for 2025 is a 50% reduction in TB incidence and a 75% reduction in TB mortality compared to 2015 levels. So there are 3 points, 3 time points: 2015, 2025, and also 2035, according to WHO. The NTB strategy 2025 goals is a blueprint for countries to reduce TB incidence by 80%, TB deaths by 90%, and to eliminate catastrophic costs for TB affected households by 2030. So we are looking at reduction in the cases of TB, deaths of TB, overall events around TB is it in the world or globally? I guess it's globally. Yeah, with regards to TB globally. I appreciate that we're trying to get more funding for TB and every other thing. But Dr. Collins, you have a closing statement for those who are listening to us.
Okay, my closing statement is anybody that's listening to us, so I'll encourage everybody to stay safe. We have learned about pulmonary TB. We should know more about it so we can educate our neighbors, educate them, apply the preventive measures. And yes, if you notice that somebody might be coughing, losing weight, advise the person to go to the hospital so that because if your neighbor is healthy, you are healthy as well. So don't say that I'm not the one, it's not my family member, it's not my brother, it's not my sister. If you neglect that person one way or another, I will come to you. So prevention is best.
Prevention is better than cure. And my mantra, my personal mantra as a person is each one help one. So help each other, educate each other. When you sneeze on a place, clean the place. When you see something that is bad, please remove it. Keep advocating to each other, and we'll have a better and a healthier world for all. That's what we want. Please, if you watch this, read Dr. Collins' paper. You can see it. The name of the paper is on this video. Please read the paper and leave your comments, because you'll watch this. This is the expert. If you don't have time to discuss with other colleagues, at least understand it for your own self, because health is wealth and education. A significant part of health is education. You cannot prevent what you don't know. You can't use what you don't know. You can't do what you don't know. So please educate yourself, because when you educate yourself, you have better understanding of your health and also can help those around you. Thank you so much and have a blessed week.